Hi, Mr. Smith. Yes, my name is Megan Rose. I'm one of the LVTs that will be helping with Felix and Cole's dental. I know that you had some questions about the dental estimate. I will go over each one with you, and I'll go over some parts in more detail because they could get kind of confusing, especially the extraction part. So if you have any questions, you could always just interrupt me and I'll try my best to answer them. Okay, well, let's get started. We could go over Felix first, if that's okay with you. He is the easier of the two, so he will be quicker going over it, and then we could go into more detail about Cole. Okay, so the first part of our dental estimate is the physical exam with the oral exam. So that's going to be $75. So we just check on the teeth, make sure everything's good, all that. And next is the blood work. You can see that 3 of them are listed. That is the basic blood work that we do. That is going to cost $200. If there is any abnormalities, we will do more blood work, but seeing how Felix is healthy and everything, I don't see that as being a possibility. So blood work should cost $200. And then next is the hospitalization for aftercare. That is $50. So that charge is basically covering the vet that makes sure that your pet is good after the anesthesia, make sure he's upright, he's healthy, he's breathing, all of that. And next on our list is going to be going over all the anesthesia and all the parts that are included under anesthesia. So anesthesia for Felix will be $200. As you know, in human medicine, anesthesia is expensive, and our anesthesia covers the actual anesthetic gas and the pre-meds. So that's going to cost $200 for Felix. Next is the IV fluids. That just makes sure that he's hydrated and his blood pressure and everything are good throughout surgery. So that's going to cost $100. Next is the teeth cleaning. Since he is only a grade 1 and it is his annual dental, I don't see us really doing much cleaning. The oral exam, we didn't really see much either, so it'll probably just be $100. And then lastly is the full mouth x-rays, and that's going to be $150. It is required for the cohat, and since he is a smaller animal, it is just going to be $150. So with all that, that total cost is going to be $875. It should be that amount if his x-rays turn out good and everything. It is going to be that amount. But if we do find anything that's concerning, we might have to extract a few teeth. But seeing how he is healthy and his oral exam went well, it should be $875. So for Cole, it's basically the same thing as Felix, just some of his prices are increased due to his larger size. So his physical exam with the oral exam, his blood work, and his hospitalization aftercare is all the same as Felix's. But his anesthesia, his IV fluids, his cleaning, and his full mouth x-rays all increased. As I said before, due to his larger size. So for the anesthesia, it's going to be increased by $50, so $250, just due because he's going to use more pre-meds and everything like that, more anesthetic gas. Same things for IV fluids. The IV fluids is going to be $150. And since he is a grade 3 diseased mouth, the cleaning is going to be $300 just because it's going to be more time in there. We're going to have to use more tools and everything like that. So it's going to be $300 for that. And for the full mouth x-rays, it's going to be $250 just because I said before, he's a bigger dog and it's just going to take more x-rays to get all of his mouth. And since, as I said before, he is a grade 3 dog, he is most likely going to need more anesthesia time. So the first 30 minutes of anesthesia is covered. So after that, you're charged $75 for every 15 minutes. So most likely he'll probably go 30 minutes over. So in total, that'd be $150. And since Cole needs some extractions, I'll go over one with you in more detail, but I'll just go over the base prices for surgical and non-surgical. For surgical extractions, each tooth or whatever, no matter they're bigger, they're smaller, how many roots they have, each one is $75. And that's the same for non-surgical, just non-surgical is $50 each. With extractions, I know the doctor said 2 of them definitely had to come out. I'm sure he went over that with you. And then we did see more that were concerning. So the price ranges are all listed on your thing. If you need help, just ask me. I'll go over a few, and if you have any questions, just ask me. So we'll go over the non-surgical incisors. So as you can see, it says 0 to 3. So if none of them come out by themselves, you don't get charged. But if all 3 of them come out, you get charged $150. And that goes for everything else. And lastly is the post-op medication or antibiotics. Since he is definitely going to get 2 extractions today, at most 12, we are going to require him to have some medication for his pain after, so that's going to be $40. So finally, your bottom line for Cole's estimate is $1,465. That's not including the 10 other extractions, just the 2 that the doctor went over with you. And that's including everything else, not the extra anesthesia time, but everything other than those 2 things. Your top half of the dental is $2,165. That is including everything. That's the 12 extractions, the 30 minutes of extra anesthesia, everything like that. Okay, well, that should be about it. If you have any questions, you could always call us at 845-567-2334. You could ask for me, you could ask for your doctor. Your doctor's Dr. Zane, right? Okay, yeah. You could always ask for him. You could ask for really any of us. We'll go over what you need help going over, and we'll answer all your questions. If you don't want to call us, you could always email us. It might take us a little longer to respond, and if that happens, you might not get it before your dental. So if anything really concerns you, just call us. Our email, though, is rosevethospital@gmail.com. So you could email us, you could call us, you could ask for anyone. Just if you have any questions, make sure you ask us before the dental so we could just get everything cleared up. All right, well, thank you for listening to me ramble, and have a great day.